You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with MiniDental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Matt Mouritsen. Dr. Mouritsen, welcome to the program.
Well, thank you. Happy to be here.
Now, for people that don't know your practice, your father was a dentist. I guess you've been there a long time.
Yeah.
Who's the typical patient that you see, and what are the different services that you offer?
Well, Randy, we don't really have a typical patient. We just pretty much take care of everybody.
Okay.
But for example, we could have somebody that came in with a loose-fitting denture and place mini implants to lock that in and secure that in. And they wouldn't have to wear that goop in the teeth anymore, and they could enjoy their smile.
You like mini implants.
I love
You
them.
even have one.
I do, yeah. I absolutely do.
And your son's a dentist, he put it in or
He
something
did,
like
he
that?
put it in, yeah. Well, I'm missing this tooth, and as a dentist, I know that having a tooth gone is going to cause the rest of my bite to collapse. I also know that, you know, it's not healthy. The other teeth are going to drift. And so I decided to replace it with MiniDental implants. And I have 2 MiniDental implants on a crown. It was done all in about an hour. I was eating dinner on it that night. And I didn't realize how much my food tasted better with having all of my bite restored, because now I can eat on both sides of my mouth. When you tend to eat on one side when you can't chew on that side. And I had gotten used to it and didn't even realize it.
Is that right? Now, in your practice, you have, I guess, of a sheet. You have this kind of concept where you do everything right there.
Absolutely, yeah. We have the CEREC, same-day crowns. We also do smiles in a day. We call it same-day smiles. People will come in. They have cracked or discolored teeth, sometimes even missing some natural enamel. And they'll leave with a gorgeous new smile of permanent veneers. They get home and their friends and family are like, "What happened to you? Did you lose some weight?" We had a lady, in fact, she couldn't stop looking in the mirror and smiling at herself. She was enjoying it so much. But yeah, it's really great. We also combine that technology with 3D imaging. So when we do place implants, we can virtually place them before. Everything's done right in our office, from the planning, the imaging, the placement of the implants, as well as the final teeth. And that way we're in control of the whole thing. We can do a great job for you. So the nice thing about the CEREC technology is the old-fashioned way is that you had to put some goop in your mouth, had to wear a temporary crown for several weeks. With this, we can put the porcelain work right on your teeth the same day, no extra visits. The other thing that I've actually found that's amazing is we have less teeth that need root canals following crowns, which is one of the common complications.
Why, it's a better fit because you're making it right
it's
there?
less traumatic to the teeth, actually,
Okay.
because you're not having a temporary on there. The other thing is we can actually preserve more of the natural enamel with the CEREC porcelains. And we also offer whitening in our office. You can take someone that's 45 years old, 4 shades whiter, all of a sudden they look younger, healthier, and just, you know, you can even take someone that has crooked teeth, and with whitening, people really feel more confident in their smile.
Is that your most popular procedure, by the way, is whitening? Because I know there's a lot of over-the-counter stuff.
The stuff that we have in our office
Is it that much better?
is really a lot better, yeah.
Now, at the top of the show, I said that according to you, nobody should be wearing a loose-fitting denture.
I couldn't agree with you more. In fact, the life-changing experiences that we've seen from giving people fixed teeth with mini implants just is so inspiring.
So if there's that many people in Utah wearing dentures that are loose, that they don't like, why aren't they all doing this? Why aren't they all getting mini implants?
You know, Randy, I think the biggest reason is they just don't know. And once you're wearing dentures, you're out of the system, meaning you haven't been into the dental office for maybe 7 or 8 or more years, and the only time you'd come in is if you had a sore spot or you need a reline, and you just don't find out about this information. And so the technology is not available because you don't go to the dentist. Another reason that they don't come in is, let me tell you about the life of a denture wearer before they got to that point.
Okay.
You know, for many years, they went through this process of crown after crown, root canal, failed root canal, trips to the specialist, gum disease, the pain, all the infection that's involved there. When they finally get their teeth out, they're just ready to be done. They don't want to see me anymore. And so
It's a lot of money, obviously.
it's a lot of money, and it's a lot of pain that they've gone through, and they're just relieved. They're relieved to finally have their teeth out.
So the last thing they want to do is go see you.
Even though,
right?
oh, absolutely. Even though the denture covers the roof of their mouth, they're not necessarily comfortable. They're hard to get used to. Most of them don't fit very well. They just don't want to see me anymore because they've been through so much.
Do you hear that still, by the way? Hey, no offense, doctor. But
Absolutely, absolutely. We get that all the
like,
time.
what do they say?
They say,
I don't like dentists?
Yeah, they say, I don't like the dental office, but I like you. And, it's okay. I don't blame them. I would feel the same way.
So most of the people, because I guess it's a highly anxious crowd.
Oh, yeah.
They don't want to be at the dentist.
Absolutely.
You have like sedation?
We do.
We
do. We have nitrous. We have Valium. Sometimes we'll even bring in an anesthesiologist. But honestly, these procedures with the MiniDental implants are so much easier and so much less pain than the old-fashioned traditional implant.
So mini implants are different than regular implants,
They are, absolutely.
but they're just smaller, these mini implants?
They're smaller. A lot of times we can place them in areas where we didn't have as much bone with the traditional implants.
Now, I've had dentists on the show in regard to mini implants, and they will say, and I'm paraphrasing slightly here, they say mini implants just aren't there yet. They're not proven. They're too small.
Right.
That traditional implants are better. What is your response to that?
I've heard that. That's kind of really behind us. Dr.
Okay.
Todd Chatkin is a pioneer in mini dental implants, recently published a study in Compendium, the dental journal, over 12 years following over 5,000 dental implants is placed. Success ratio of in the mid-90s, basically the same as traditional implants.
So they work.
Absolutely. Dr. Gordon Christensen is a pioneer and a guru in dentistry. He says everyone should be using mini dental implants, and it's the future. It's the future. I have one in my own mouth.
You could have put a regular.
I could have put a regular one in, but I chose to use a mini because they're better. They're smaller, and that's what the technology is going to, is something that's more affordable. They're a fraction of the cost of the traditional implants.
You say they're close to half the
They
price.
are, yeah. And to me, the even bigger thing is the amount of downtime. The traditional surgeries to put in implants, people would be out of work for several weeks sometimes. And with mini implants, like my own, I was eating dinner on it that same night. In fact, the other day, we were actually doing a mini implant surgery, and you just put a pinhole in and just put it in there. You don't have to open the gum tissue like you do with traditional implants. We got done doing his lower arch, and he said, "Wait." And I'm like, "What?" And he goes, "I'm not bleeding. I'm not in pain." And I said, "Yeah, we're almost done." People are just amazed. They're amazed when they do this, particularly because their expectations are that it's going to hurt a long time. They've heard stories about how expensive it is. When it's a fraction of the cost, it works great.
So now, for the denture crowd that's watching this, or the people that they're headed to dentures, is it true that somebody could go in with no teeth, right, on the day of the procedure, and
Yes.
walk out with teeth that are locked in, like
Yes.
snap in, snap out, or even fixed teeth?
Absolutely.
Is that right?
Yeah, we do both of those things where, and with the 3D imaging technology we have, we can plan the surgeries to make the implants exactly where we want them, to plan the restorations to be just where we want them to be, and people can come in and have it the same day. Going back to the affordability thing, some of the stories are really inspiring. We had a gentleman that he'd been saving up for traditional implant teeth and for several years, and just as he was getting started on this, his wife was diagnosed with cancer. So they used all those funds to treat her cancer, for the medical treatment and all that. He found out about the mini dental implants, came into my office. Because they're so affordable and so easy, he was able to get his wife's medical treatment as well as restoring his teeth, and now he's enjoying his beautiful smile.
Nice. That's a great story. How old can you be to get this done?
That's the crazy thing too, is really there is no limit. We have a group of ladies. This is kind of funny.
Okay.
There's 4 women in their 80s, and they go out on the town. They go to the local theater called the Hale Center Theater once a month and go to plays. They go to lunch once a week all together. So what we did is we gave her a full arch of teeth supported by MiniDental implants. And when you're older, your lower teeth show quite a bit.
When you're talking, yeah.
When you're talking. And so she was embarrassed before, and now she's proud of her smile. She has gorgeous teeth. Not only that, when they go out to lunch every Tuesday, she can choose the salads and the foods that she used to be able to enjoy. Now these 4 80-year-old women are out terrorizing the town again.
Eating whatever they want. Now,
Yeah.
I mean, how soon can you eat? So on the day of the procedure, when you put them in and you put the teeth on top.
Many times you can go back to your lifestyle and eating virtually right away. One of the cases we had, and you don't realize the little things in life that you miss. His wife called the next day and she said he had a cheese sandwich the night that we placed his MiniDental implants. You and I wouldn't think anything about that, but you miss the little things in life.
So he just even couldn't chew bread before?
Yeah.
Really?
Right. And so to have little things like that, you just don't realize what you're missing in life when you don't have your teeth, when they're moving around, when you're having to put the goop in there, when you're in pain because the dentures are loose. You don't realize the little things that are quality of life issues.
Now you're a dentist. Of course, you probably think the smile's pretty important. Having teeth are pretty important because that's your...
You know, I do, but I wouldn't take my word for it. If you read People magazine, Cosmo, in fact, Men's Health just came out with a study and they listed the smile as the #1 thing that's most attractive to the opposite sex, even more than your physique.
Okay.
But if you have both, just think how great that would be. But I'm only a dentist. I can't...
Well, smile, yeah. I guess when they survey people, that smile is, yeah, it's always in the top 3.
But you know, the funny thing about that is, though, when we give someone a locked-in set of teeth, now they feel better about themselves. They look in the mirror, their mojo's back. They feel good about themselves. Not only that, they can go back to eating those healthy foods that they've craved, the carrots, the salads for lunch. And so maybe a side benefit, you may lose a few pounds. That's a bonus. I won't charge for that.
Because you're eating more fibrous foods, I guess.
Right. Yeah. So you may get the smile and the physique that Men's Health talked about. Well, you know, the other thing about a smile is if you were to compare 2 people on a job interview, the one that's going to smile is the one that's going to get the job. And so it's one of those things in life you don't realize how important it is. But when someone smiles, they make you feel good inside too. It's a way of conveying warmth and love between humans. And another thing, people with bad teeth, they're discriminated against.
What do you mean?
People think, like in movies, they'll take out one tooth or darken it, and makes you think the person's not as intelligent.
All right, good point.
That's not anywhere true. We give people their smiles back, and all of a sudden they get their confidence back. They feel like they can go out in public and talk to people, and they can do the things that they used to do. And also, if you have bad teeth, people think you're not clean. In the movies, they're discriminated against if someone has dark teeth or missing teeth, things like that.
Yeah, I guess they darken the teeth if they want to make somebody look like a bad guy.
Yeah, for sure. Well, let me tell you another thing about when we're able to fix people's teeth and they have more confidence in their smile. This one gentleman, we gave him locked-in teeth with the MiniDental implants, and he had been avoiding his best friend, a lifelong best friend. He'd been avoiding him for 10 years because he didn't have teeth. And as soon as he got his teeth back, his wife called and she said he called his best friend. They've gotten back together again.
So because he was like embarrassed? Because
he was so embarrassed, he would not even talk to his best friend for 10 years.
Face to face?
Face to face. No, at all.
Oh, really?
Yeah.
And this is the story the wife told you?
It's true.
So now I know a couple of denturers though, and they seem to be fine. They don't complain at all.
I'm sure they don't complain to you because I'm the dentist and I hear about it. One of the stories that was really touching I heard lately was of a family who every Tuesday night they would have tacos, and after the man lost his teeth and was wearing loose-fitting dentures, he could no longer enjoy Taco Tuesday with his family. All the neighbors would come by. It was basically a really fun party every Tuesday night. Ever since we were able to give him MiniDental implants, give him his teeth back, the family's gone back to that family time of enjoying Taco Tuesday.
So you really can't, I mean, you could chew, like let's just, and by the way, there are options. You could either do a snap in, snap out,
right,
or a fixed full arch of teeth supported by these mini implants. Could you eat hard things? Like front tooth, you bite into an apple,
Amazingly, yeah.
or broccoli, or a carrot, or whatever.
You know, people find that these teeth not only look great and they enjoy smiling and it's giving their confidence back, but the crazy thing is that we have people that come in just because they want to have their teeth look great and they find the functions amazing, that they're able to bite into an apple, they're able to chew a carrot, they're able to go out to steak at their favorite restaurant where they weren't able to before.
So you can eat, because I've also had dentists say, yeah, but the mini implants are really for smaller people. You're a 6'4" guy.
Right.
You have a mini implant
do.
on the chewing part of your mouth.
Yeah.
So you don't worry about that?
I love it. It functions just like a normal tooth. And we found that all of our patients, that the MiniDental implants are as stable as traditional implants.
Now, we should mention insurance, even if you have the best insurance, does not cover this whole process, the mini implants. Medicare, Medicaid does not cover it either.
Well, the great thing about that is first of all, they're a fraction of the cost of traditional implants. So that helps right off the bat. And then we have people in our office that do financing and help you come up with affordable plans. And we can pretty much fit it into any budget.
Now, we're talking a lot about how, dentures aren't that great, right?
Right.
At all.
Right.
But you told me that you have made like 500 or 1,000 dentures over the years.
I have,
right?
yeah, for the last 25
years. So what do you say
years.
to those people that are watching this that maybe you made them a denture?
I say that's great. Come in and let's lock it in with the MiniDental implants. They've become so much more affordable and the technology is awesome. The downtime is virtually zero. In fact, we had a guy the other day that was preparing for his retirement and he wanted to get his dentures locked in. So we came in, we gave him a beautiful set of teeth. Now they're secure. All he wanted to do in his retirement is ride his Harley around the United States and maybe look for a woman to share his retirement with.
Okay, so teeth can change your life.
Absolutely. He was so much more confident after that.
What about this? Somebody with the bleeding gums, bad breath, loose teeth, they got, I guess, periodontal disease or gum disease. Are their gums too bad to do this? Especially with the mini implants.
What people don't realize is that the infection is on the teeth. As soon as we remove the teeth, we can get the tissue healthy and we can place those mini implants.
So you could have really bad gums and still get this done?
Absolutely. You can have a small amount of bone, you can have really bad gums. We have ways to help you out. One more thing I'd like to point out, to those people that have dentures, if they could try them out for just the weekend, they'd never go back because it's life-changing. Both being able to eat the foods that you want, be able to chew an apple, to be able to have the salad that you've been craving, to be able to smile without loose teeth.
Is this one of those things where when it's all done, they say, I should have done this years ago?
There's so many people that are in their 40s and 50s that are wearing dentures. And when they realize that they've missed out on so many good years, they always say, I should have done this years ago.
So you've been working with dental implants for about 14 years.
I have.
Is that right? And so now how did you stumble onto these mini implants? Because a lot of guys are skeptical about the mini implants.
I was skeptical as well. And I did all the research, found out that Gordon Christensen.
So he's like one of your gurus in dentistry?
Gordon is the leading researcher in dentistry and worldwide name. And he's totally in support of mini implants and says that that's the future of dentistry and the future of the way the technology is going.
So you like them. So now we talked about you have 500 denture wearers, 1,000 denture wearers. Is it close to 1,000 that you've made dentures for?
I would say.
So if they're all watching this and they decide to come in, you couldn't handle it, right? You couldn't handle the business.
That's okay.
There's probably not enough dentists in Utah to handle
that's
if
true.
they knew how good it was. And I don't want to put words in your mouth.
Yeah, that's, if people realized, if they realized how much it's life-changing, they would want them right away.
Now your son works in your office as well. He's a dentist. Does he do the mini implants? Are you training him with the mini implants?
He does. He did the one in my own mouth and did a great job at it.
So you both do kind of the same thing?
We do. We
Within
work together and it's really fun to practice with him. He's a fantastic dentist and a fun guy to be around.
With Utah, and we've had this discussion that a lot of people, because they are really good friends with their dentist,
right,
and they don't like to switch dentist, right?
Yeah.
And their dentist may not do mini or small, you call them small diameter mini implants, to replace missing teeth. So you work with these dentists though.
We do, and feel free if you want to stay with your dentist just to come. We'll help you out. We'll help your dentist to maintain the mini implants and the and the teeth once they're in, and you can stick with your dentist.
Stick with your dentist, but you'll just handle the mini implants. Or
Absolutely.
The mini implant
We can work with you.
Now, with if a patient's watching this and they're still afraid, though, they're going, I don't know, this seems painful. It seems, it's like you said at the beginning. These people with false teeth don't want to go to the dentist because of all they've been through.
Right.
So what do you say to the ones that are still afraid and they're just saying, I don't know, this just seems so painful, or they think they're too old?
We have a lot of people in their 80s, and in fact, this is kind of funny. We had a lady whose daughter brought her in. She's 85 years old, and while she was talking, all she could do was spin her denture around in her mouth. It was so distracting, and her daughter said, "You've got to stop her from doing this." And the lady said to me, "All I want to do is eat a hamburger." So
that was her goal.
That was her goal, is just to have a hamburger. And her daughter's goal was to have her stop spinning her teeth around in this funny little habit that she had developed with this loose denture. We were able to fix it in with 2 mini implants. Everybody's happy. She's had a hamburger.
So two mini implants right here. They get a full arch of teeth and just snaps it in.
You can do 2. We can do mini. We can have it snap in and snap out. We could also lock it in permanently. There's all kinds of options and ranges of things depending on where your finances are.
We've had this discussion, you and I, where if you're lucky enough to be 80 years old, right?
Yeah.
And 80 is not that old, I guess.
It isn't
anymore. But it seems like your life, my dad's 80, revolves around food.
Oh, absolutely. And socializing. I mean, those are the 2 things in life that we enjoy the most. And we enjoy being with family and friends, and laughing, smiling, the confidence to do that a nice set of teeth gives you. We also enjoy eating at the same time. So what are the 2 things in life that give us the most pleasure? Is being with our family and friends and eating, and most of the time at the same time. We have so many people that we've been able to give them their life back. It's not really about teeth. It's about their life, and it's about enjoying their life.
So you love this mini implant thing.
I can't wait to go to work tomorrow because it's so great. It's so great to hear these stories from these people. It's so inspiring to me. It's to hear and see the changes I can make in people's lives, to change their life from wanting to stay home to going out and being able to sing in the choir again, to be able to go skiing. I love to be active. So, someone tells me that they weren't able to enjoy water sports. And
that's right. I guess with a denture, you don't do water sports.
Yeah, and so with the MiniDental implants, fraction of the cost of what it used to be, and now they can enjoy their life again. And having people get their life back is priceless.
Now, I guess the way it's normally done is in 2 places. You go to one place that they do the surgery, another place they put the tooth on top across the country.
We do everything in one stop.
You do both parts.
Which is really nice. Not only do we have the 3D imaging so that we can place those virtually, we actually place the implants virtually before we do it on the computer, but we place the implants, we place the teeth on the top of them all in one afternoon. And much more affordable.
You make it sound easy, by the way.
Honestly, so many people say it's virtually painless. They're back to their life within days.
Now, do you have dental buddies that you, I guess you go to these conferences where you say, hey, you got to do this? Do you try to talk your friends into getting into this?
I do, yeah, and some of them are still skeptical. I try to point them towards Dr. Christensen, Dr. Shatkin, and some of the leaders that are encouraging this. But honestly, I can't see any reason why not to take advantage of the latest technology. Years ago, when the traditional implants came out, we said those wouldn't work. Now they're a proven technology. The mini implants are the same way.
Now they're FDA approved.
They're FDA approved.
To be effective.
They've been used in people's mouths for 10 to 15 years now, and they're very effective. They have the same rate of success as traditional implants.
Now, with all of your patients, is this the happiest group of patients? You could take somebody that can't eat, they can't chew, or maybe they're just wearing a denture and then you give them their teeth back.
It's honestly, it's thrilling to be able to see the changes in people's lives. It's really touching. I think
you told me they hug you sometimes.
They do, and some people talk about how emotional it is to be able to have the foods that they've been craving. Just to simple things in life that we don't realize, but to be able to eat a steak. One of the guys said that was his favorite thing, to go to Sizzler with he and his wife. Just little things in life, but it makes such a difference in the quality of our lives.
So denture wearers, because I mean, what, they just can't like tear the food? I mean, they don't eat steaks at all? I mean, could you eat a steak with a denture?
You could probably eat a steak with no teeth at all, but it would take you 3 or 4 hours.
Just takes you longer.
Yeah.
So this is...
So no, I mean, it's just, it doesn't work effectively. And to be able to have those stabilized, locked-in teeth that we can do with the mini implants can totally change it, where you can eat just like you did with your natural teeth. You can smile, you can do all the physical activities and enjoy life again. You basically get your life back.
Okay, good. Now, it's a free consultation if they go to your
absolutely.
office. Do they get to see you?
There's no reason not to come in. There's no reason not to come in and at least find out what your options are. If these people knew how good it could be, if they could try it even for one weekend, they would never go back. And so for them to come in, talk about the options, talk about how affordable it is, talk about how painless it is, there's no reason not to come in.
You know, I think you actually told me this, that, you know, in dentistry, that it's been a lot of patchwork. You know, you're always filling things in, temporary fixes like a bridge or whatever. And this is one of those things, as you pointed out, you get their teeth back. Is that how you kind of look at it?
Yeah, I mean, I look at it that many of these people have been through so much, like we talked about. They've been through losing their teeth and all of those things.
You know, we really are out of time. Good stuff. But if somebody's watching this, and again, they're still skeptical or afraid, they're headed to dentures or they're wearing a denture.
Right.
What do you say to them?
I say, come in and find out your options. You owe it to yourself to know what's available and to know how affordable it can be. Within a half hour, so we'll know if you're a candidate for this. Many people, regardless of age, regardless of what you've been told about how much bone you have, many people were able to help with this procedure and change their lives and make a difference. Start enjoying your life again. Why wait?
Okay, good. Thanks again for coming on the show. Great stuff.
Thank you. I appreciate you having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.